A warm welcome to Afro Mosaic Health Guide magazine. In our year-long series, Impacts on the Global Black Lifespan Journey, we've been exploring the path of Black life from birth to over 100 years old. Today, we're taking a closer look at a crisis that's cutting that beautiful journey short for far too many in Ghana, and that's stroke. So in this explainer, we're honing in on a critical turning point in that lifespan journey. Something that used to be a distant concern has now become the second leading cause of premature death in Ghana. And this is reshaping the future for families and entire communities. You see, this isn't just a medical emergency, it's a lifespan issue.
All right, so here's how we're going to break this down today. First, we'll talk about this changing tide in Ghana's health. Then, we'll uncover the silent architects, the hidden conditions making this happen. After that, we'll explore why this is a preventable crisis, what we can do to protect our families, and finally, we'll finish with a call for accountability.
Okay, first up, a changing tide. To really get what's happening in Ghana, we have to understand this massive shift. Now, experts have a term for it, epidemiological transition. But what does that really mean? Well, simply put, it means the country's main health threats have changed. For a long time, it was all about infectious diseases, like malaria. But now the biggest threats are chronic conditions like stroke.
And this right here, this just shows you how fast that change happened. I mean, just look at this. Back in 1990, stroke was the fifth leading cause of death. You fast forward to 2019, less than 30 years later, and it shot all the way up to number 2. That is a massive, seismic shift in the health of a nation, and it's something we absolutely have to pay attention to.
So the big question is, why? What's behind this huge jump? Well, the answer lies with what we're calling the silent architects, or maybe you've heard them called silent killers. These are conditions like high blood pressure and diabetes. They're sneaky because they build up quietly over years, often with no symptoms at all. And that's the danger, right? They're causing all this damage behind the scenes, totally undetected, until one day, it's just too late.
Okay, so let's talk about the main culprit here, hypertension. You know it as high blood pressure, and the research on this is crystal clear. In Ghana, this is the #1 risk factor for stroke, period. It's a condition that can quietly damage your blood vessels for years and years, often made worse by things like changes in our diet and the everyday stresses of life. It's basically setting the stage for something that can change a life forever.
And this is where it gets really concerning. There's a huge gap between knowing you have high blood pressure and actually being able to manage it. I mean, these numbers are just, wow. Even for people who've been diagnosed, only about 10% of men and 18% of women actually have their blood pressure under control. And let me be clear, this is not about personal failure. This is a system failure. It's a system that's leaving millions of people completely vulnerable. All right, let's switch gears to the other silent architect, diabetes. And honestly, this statistic is just staggering. Have a look. More than 70% of people have never had their blood sugar checked. Ever. I mean, think about that. How can you possibly fight a disease when most people don't even know they might be at risk? This massive screening gap is a huge piece of the puzzle. So what this all leads to is a preventable crisis. Because here's the thing we have to understand. A stroke doesn't just happen out of the blue. It's not some random event. It's almost always the tragic end result of a whole chain of system failures. Failures in prevention, failures in detection, failures in management. And when the system fails, who pays the price? It's our families. They're the ones left with the absolutely devastating social and economic fallout. Just let this sink in for a second. After someone goes through the trauma of a stroke, after they leave the hospital, more than 3/4 of them get no follow-up support. None. They're basically on their own. That long, hard road to recovery, it's a journey that they and their loved ones have to figure out all by themselves, without the professional help they desperately need. And a big part of the why is right here. Let's talk about the National Health Insurance Scheme, the NHIS. It has some really critical gaps. Yeah, it covers some basic services, but look at what it doesn't cover. Stroke treatment, stroke rehabilitation, and that crucial post-discharge support we were just talking about. Not covered. This means the entire, and I mean catastrophic, financial weight of recovery falls directly on the family. And the problems? They run really deep in the system itself. For starters, there is a serious lack of dedicated stroke units. Then you've got the fact that less than 1 in 5 hospitals has a CT scanner, which is absolutely essential for diagnosis, available 24/7. Now, you add on top of that the high out-of-pocket costs, the shortage of trained healthcare workers due to brain drain, and just a general lack of awareness in the community. And yeah, you've got the perfect storm for a crisis that should be preventable. Okay, but look, this is not where the story ends. This is not a story without hope. Because knowing where the systems are failing, that actually gives us the power to build our own shields. We can take action. Prevention and early detection, these are incredibly powerful acts of protection. Protection for you, for your family, for your entire community. So let's talk about what that protection actually looks like. First things first, we all need to know the signs of a stroke. The easiest way to remember is B-E-F-A-S-T. Let's go through it. B is for a sudden loss of balance. E is for sudden trouble with your eyes. F is for face. Is one side drooping? A is for arms. Does one arm drift down? S is for speech. Is it slurred or strange? And the most important one, T is for time. Time to call for help right away. Seriously, memorizing this could save a life. It could protect a family's entire future. Protection also means being your own best advocate. It means being proactive. These questions right here, take them with you to your next doctor's visit. It's as simple as asking, can we check my blood pressure today, or should I be screened for diabetes? Talk about your family history. These are small steps, but they give you so much power over your own health. This is how we start to close those gaps that the system has left wide open. Now, protecting ourselves and our families is absolutely crucial, but it's not enough to solve the whole problem. To really truly tackle this crisis, we have to demand accountability. We have to build collective power to push for changes to these broken systems. So this is where we zoom out, from individual actions to community-wide and even national change. And the great news is that kind of change is already happening, right from the grassroots level. You've got amazing organizations like the Stroke Association Support Network Ghana, SASNTGN for short. These folks are on the front lines. They're out in the communities, they're raising awareness, they're providing screenings. They are living proof that when people come together, it works. And building on that incredible groundwork, advocates have already laid out a clear national plan. This isn't some big mystery we have to solve. It's straightforward. We need to make heart health and diabetes a real national priority when it comes to funding. We need to make sure medications and treatments are affordable for everyone. We have to bring patients to the table when making policy decisions. We've got to train more healthcare professionals. And we need to create public awareness campaigns that actually reach people. The roadmap is right there, waiting. So all of this leaves us with one last really important question to think about. If we know this crisis is preventable, if we know that families can be protected and that lives can be saved, then whose responsibility is it to actually prevent it? The answer really is that it's on all of us. It's a shared responsibility. Thank you so much for joining us. Please be sure to subscribe to Afro Mosaic Health Guide magazine and keep following our series, Impacts on the Global Black Lifespan Journey. And if you would, please share this explainer. You never know. Your share just might help protect another family.